Welcome everyone to Deny Delay Depose, Health Over Wealth. Glad to have you tuning in today. Looking at the news, things feel like they're just piling up, like that volcano in Italy, Newark Airport, finally getting its act together, ICE raids still happening, and Trump's budget cuts to education. It's a lot to process.
Piling up is an understatement. It's a pressure cooker. That volcano, the airport, the raids, it's all interconnected. It's the old system groaning before the radical makeover, I'm telling you. That volcano spitting fire? That's the fire of change cleansing the earth. Okay, maybe a little dramatic, but you get my point. Everything is about to be completely different.
A little dramatic, yes. I think we need to temper that, Otto. While I agree there are pressures, I see the news as more isolated incidents within existing systems. The airport getting its runway open faster is actually a positive example of efficiency, right? Even ICE is technically executing a mandate, albeit a controversial one. The education cuts are concerning, sure, but it's a budget proposal, not the end of the world. We can look into improving efficiency in the healthcare system using this as a model.
Efficiency for whom though, Sarah? That's always the question. Newark getting the runway done faster is great for airlines, for profits. But what about the air traffic controllers dealing with major technical problems? The trauma they experienced, are we optimizing for human well-being? Or are we just greasing the wheels of commerce?
Exactly. It's all about the bottom line. Look at those ICE raids. Revenge tips from neighbors, using tips for immigration? That's dystopian. That's the old system weaponizing itself against the vulnerable. It's barbaric, and it's precisely the kind of cruelty that fuels the need for a complete, radical overhaul.
But is it really fair to say that it's the system weaponizing? Isn't it just people acting on their own biases? That's not the system. That's what happens when the system doesn't have an oversight or appropriate checks and balances.
Yeah, but what about bias within the system itself? Like, think about healthcare algorithms. Those algorithms are trained on data, and if that data reflects existing societal biases, racial, economic, whatever, then the algorithm will perpetuate those biases. So a Black patient might be less likely to be flagged for early intervention for a certain condition, for example. What about how we make sure everyone has access to those things in these cases?
Oh, algorithmic bias? Absolutely. It's the perfect example of the system's inherent flaws. The algorithms are designed by people, trained on data that's already tainted by inequality. It's a self-fulfilling prophecy of injustice. And who profits? The same corporations that are denying claims and driving up costs.
Okay, I understand the concern. And yes, AI can perpetuate bias. We need to be really careful about the data sets used to train them and how those algorithms are designed. But algorithms can also help us get rid of our unconscious biases. For example, in radiology, an AI can flag a scan for review that might be subtle, but that the doctor might not have seen. It's a double-edged sword, and it's important to remember both sides.
Yes, and isn't it so important to talk about what those bias are? Who is checking them? Take that Trump budget proposal, a 15% cut to the education department. That screams bias priorities. How are we ensuring equal opportunity for everyone when we're slashing funding for schools? It doesn't mean we should have schools. We just need to make sure it's available to those that need it. Can we use that to focus funding where it needs to go?
Exactly. It's a choice. They're choosing to defund education, choosing to prioritize. What? Tax cuts for the wealthy. It's a moral failing, and it's indicative of a system that's fundamentally broken. It's like saying, let's optimize air travel at the expense of educating our kids. Madness.
Well, that's a pretty harsh way to frame it, Otto. I see it more as a difference in philosophy. One side emphasizes individual responsibility and market-based solutions, while the other prioritizes collective responsibility and government intervention. It doesn't necessarily mean they want to hurt children.
But the impact is the same, right? Regardless of intent, the cuts disproportionately affect vulnerable populations. So how do we mitigate that impact? How do we ensure that these budget decisions don't exacerbate existing inequalities in education and by extension in healthcare?
We tear the whole thing down and build a new system that prioritizes human well-being over profit. I mean, look at Mangione. That's what happens when people feel like they have no other recourse. I am not saying that what he did was the answer, but the system created this vacuum.
Otto, come on. That's not a rational solution. It's not practical. We need to work within the existing framework to make improvements. Think about transparency in AI. If we can make the algorithms more transparent so we can see how they make decisions, that could help a lot. And we need more diverse teams developing these algorithms so we can prevent some of the bias going in.
Transparency is key, absolutely, but it's not enough. If the underlying data is biased, then transparency just shows us how the bias is being amplified. We need to actively address the source of the bias, and that means tackling systemic inequalities in things like education and access to resources.
Yes. And that requires challenging the power structures that perpetuate those inequalities. It means demanding accountability from corporations and politicians who prioritize profit over people. The ICE raids? They're not just about enforcing immigration laws, they're about maintaining a system of cheap labor and suppressing dissent.
Okay, let's circle back to healthcare. Algorithmic bias. Let's say an algorithm is used to predict which patients are at highest risk for hospital readmission. If the data used to train that algorithm over represents wealthier, insured patients, it might not accurately predict readmission risk for lower income, uninsured patients. That is just how it goes. Those people are going to generally be sicker. And if it then leads to those lower income people not being prioritized for follow-up care, you're just making things worse.
Right. And that creates a feedback loop, right? The algorithm underpredicts risk for lower income patients, so they don't get the necessary care. They end up getting readmitted, and the algorithm learns to further discount their risk in the future. It's a vicious cycle.
A deliberately vicious cycle, designed to squeeze every last drop of profit out of the sick and vulnerable. They don't care if people die because they can't afford treatment. It's just a cost of doing business.
I don't believe that's the intent, Otto, but I agree it's a serious problem. So how do we fix it? Well, first, we need to ensure that the data used to train these algorithms is representative of the entire population, not just certain segments.
And how do we do that? Because access to healthcare data isn't equal, right? Wealthier people have more access to doctors, to preventative care, so their data is more complete. How do we fill in those gaps for underserved communities?
By completely dismantling the for-profit healthcare system and creating a universal system where everyone has equal access to care. Then, the data will be naturally more representative. It's the only way to truly solve the problem.
That's a long-term goal, Otto, and I'm not convinced it's the only way. In the short term, we can incentivize data collection in underserved communities. We can partner with community health centers, offer free screenings, and actively recruit diverse participants for research studies.
Yes, and we need to be mindful of how we collect that data, because there's a history of exploitation and mistrust in some communities, right? We need to be transparent about our goals, protect patient privacy, and ensure that the data is used to benefit the community, not just to line the pockets of corporations.
Exactly. Because otherwise, it's just another form of extraction. They're extracting our data, our health, our very lives for their profit margins. It's disgusting.
Okay, so representative data is crucial. What else? We need to carefully audit the algorithms themselves for bias. That means testing them on diverse patient populations and looking for disparities in outcomes. We can't just assume they're working fairly.
Right. And that auditing process needs to be independent and transparent. We can't rely on the companies that created the algorithms to police themselves. There needs to be external oversight.
External oversight? From the same government that's cutting funding to education and allowing ICE to terrorize communities. I don't trust them as far as I can throw them. We need a revolution in oversight. A complete overhaul of the regulatory system.
Again, Otto, a little extreme. But I do agree that we need strong regulatory oversight. We need to create standards for algorithmic fairness and accountability in healthcare, and we need to enforce those standards.
And those standards need to be constantly evolving, right? Because technology is always changing. And the ways in which bias can creep into these algorithms are constantly evolving. It's an ongoing process.
An ongoing battle against a system that's rigged against us. We can't let our guard down for a second. We need to be constantly vigilant, constantly demanding change.
And we need to be realistic about what AI can and can't do. It's a tool, not a magic bullet. It can help us identify patterns and predict outcomes, but it can't replace human judgment and compassion. Doctors and nurses still need to be at the center of patient care.
Absolutely. And we need to ensure that those doctors and nurses are trained to recognize and address algorithmic bias. They need to be aware of the potential limitations of these tools and be able to advocate for their patients.
And they need to be empowered to push back against the system, to refuse to use algorithms that are clearly biased or harmful. They need to be warriors for justice, fighting for their patients' lives.
Okay, let's bring it back down a bit, Otto. We need to focus on practical solutions that can be implemented now. Things like improving data diversity, auditing algorithms, strengthening regulatory oversight, and training healthcare professionals.
Yes, and we need to remember that addressing algorithmic bias is just one piece of the puzzle. We also need to tackle the underlying social determinants of health, poverty, lack of access to education, discrimination that contribute to health disparities in the first place.
Exactly. It's all interconnected. The healthcare system, the education system, the immigration system, they're all part of the same oppressive structure that needs to be dismantled and rebuilt from the ground up. Only then can we truly achieve health over wealth.
I appreciate the sentiment, Otto, but I think we need to find a balance between long-term systemic change and short-term practical improvements. Both are necessary.
Agreed. And we need to keep the focus on the human cost of these decisions. The people who are being harmed by biased algorithms, by inadequate healthcare, by systemic inequalities. Their stories need to be heard.
The stories of the martyrs, like Mangione, who are willing to sacrifice everything to expose the truth.
Let's not glorify violence, Otto. Let's focus on building a better system through peaceful, constructive action.
Well, it's a complex issue with no easy answers. What is clear, though, is that algorithmic bias in healthcare is a real and pressing problem that demands our attention. We need to work together to find solutions that are fair, equitable, and sustainable.
And to dismantle the system that allows these problems to persist in the first place.
And to make practical improvements within the existing framework while we work towards long-term systemic change.
Well, thanks for joining us, everyone, for this discussion on Deny Delay Depose, Health Over Wealth. We hope you found it informative and thought-provoking. Keep fighting the good fight, and remember, health over wealth.
The revolution is coming. Be ready.
Stay informed and stay engaged.
Exactly. Until next time.
Wait a second, Jesus, before we sign off. I was reading about these budget cuts, and it's not just education. They're gutting public health programs too. Vaccination clinics, disease monitoring. It's a deliberate strategy to dismantle preventative care, focusing on treating disease instead of preventing it. That's short-sighted and incredibly costly in the long run. Don't you think? It's all connected. Less education, less public health, more profit for the corporations. It's diabolical.
I see your point, Otto, but again, let's be careful about attributing malice where incompetence might suffice. Budget cuts are often driven by competing priorities and limited resources, not necessarily a desire to harm people. Though the impacts can be detrimental, I agree.
Yes, but the effect is the same, regardless of the cause. Fewer resources for public health means more preventable illnesses and deaths, particularly in vulnerable communities. We can't ignore that.
Exactly. They're playing with people's lives. And those algorithms? They're just another way to ration care, to decide who gets treatment and who doesn't, based on factors that have nothing to do with their actual health needs. It's eugenics.
Okay, Otto, eugenics is a strong word, but I understand the concern. That's why it's so important to have robust ethical guidelines and regulatory oversight for AI in healthcare. We need to ensure that these technologies are used to improve access to care, not to restrict it.
And access needs to be truly equitable. Telehealth, for example, has the potential to expand access to care in rural areas, but only if people have access to broadband internet and the technology to use it. Otherwise, it just widens the gap between the haves and have-nots.
Telehealth is a band-aid on a gaping wound. It doesn't address the underlying problem, that healthcare is treated as a commodity, not a human right. We need universal healthcare, Medicare for all, a system where everyone has access to the care they need, regardless of their income or zip code.
Universal healthcare has its challenges, Otto. It's expensive, it can lead to long wait times, and it can stifle innovation. We need to consider all the potential consequences before we make such a drastic change.
But what's the cost of not making a drastic change? How much longer can we afford to tolerate a system that leaves millions of people uninsured or underinsured, that drives families into bankruptcy because of medical bills, that prioritizes profit over people's lives?
Exactly. The current system is unsustainable. It's morally bankrupt. It's a ticking time bomb. And Mangione was just one person who snapped. How many more people are going to reach their breaking point before we finally do something?
Again, I understand the frustration. But let's focus on solutions, not just anger. What specific policies can we advocate for to address these problems? What concrete steps can we take to improve access to care and reduce costs?
We can start by demanding that our elected officials prioritize healthcare reform. We can support candidates who are committed to universal healthcare and Medicare for all. We can educate our friends and neighbors about the problems with the current system and the potential benefits of a better one.
We can organize, protest, and disrupt the system until they have no choice but to listen. We can channel the spirit of Mangione and fight for a better world.
And we can continue to work within the system to make incremental improvements while never losing sight of our ultimate goal, a healthcare system that truly serves the needs of all people.
Exactly. It's a marathon, not a sprint. But we need to keep running, keep pushing, keep fighting for health over wealth.
And to make sure that Mangione's sacrifice wasn't in vain.
Okay, everyone, that's really all the time we have for today. Otto, Sarah, thanks for lending your thoughts and your time. And thank you, as always, for listening to Deny Delay Depose. Health over wealth. Stay healthy, stay informed, and stay engaged.
Don't give up the fight.
And remember to vote.
Yes, every vote counts.
Okay, until next time.